My name is Ann Winslow, and I'm the co-coordinator of the Lancaster Healthcare Rights Committee of Put People First, PA. Today we're taking part in the statewide action of Put People First, PA against healthcare profiteers, including Penn Medicine, UPMC, and Joel Friedman. We stand in solidarity with Pittsburgh and Altoona, who have also had their health care compromised by the closure of hospitals due to the corporate greed of UPMC, who has not lived up to its nonprofit status of taking care of communities in which they operate hospitals. During this action, we're practicing Governor Wolf's guidelines of social distancing, wearing gloves and masks, and are conducting the essential action of protecting the safety, well-being, and health care rights of the citizens of Pennsylvania. Our action today is essential because our local, state, and federal governments have failed to adequately provide for the safety, well-being, and the health of our people. It is estimated that 3.5 million people nationwide will lose their health insurance due to job loss or layoffs, in addition to the approximately 27.5 million people, also nationwide, that are already uninsured. Our federal government is only now starting to roll out a one-time stimulus check, but only to those who qualify to receive it, leaving approximately 20% of the country without any form of assistance. Despite our best attempts, those who find themselves without paychecks have had little success getting through to file claims due to an overburdened unemployment and social service system. According to an article in LMP yesterday, our nursing home and long-term care facilities are virtual petri dishes for COVID-19. Although specific facilities weren't named, the article stated that there have been 248 cases, which included both residents and staff, 20 deaths across 17 facilities, and 13 of those facilities have had outbreaks of COVID-19. The number of cases in nursing homes and long-term care facilities amounts to 20% of the 914 cases the state has reported to Lancaster County, and the 20 deaths amount to 69% of the 29 coronavirus deaths the state has reported. NBC Nightly News reported last night that these facilities are only obligated to report a resident's condition to the primary guardian and not other family members calling to check on their loved ones. Due to the HIPAA, these facilities cannot tell other residents or their families if there are cases in the facility. And many states are not requiring these facilities to report cases to the Department of Health. We must do better to take care of our older residents who deserve to be safely and adequately cared for in their increasingly vulnerable state. Our local elected officials have done little to put the pressure on our state government to meet the needs of their people, and the state government has done little to put pressure on the federal government to do the same.
Boo.
Put People First PA refuses to sit by and idly wait until our needs, the needs of the poor and the dispossessed, are met. We refuse to be relegated to the bottom of society's ladder, being told that we need to be grateful to receive the least amount of benefits despite being the most vulnerable, a position intentionally created by the ruling class. We refuse to be silenced. We refuse to be unheard simply because the ruling class has deemed us unfit to dine at the table. Today, we're crashing your banquets that are unaffected by the current crisis in our communities and are issuing the following demands to both Governor Wolf and the federal government, as well as demanding that our local governments both support and echo our demands. Number one, the hospitals at UPMC closed here in Lancaster and Sunbury must be reopened to the public. Since UPMC has not done so, the governor must seize and reopen them to take care of everyone who needs care during this pandemic. Hahnemann Hospital in Philly should also be seized and reopened to care for people throughout the pandemic. We remember the public health problems created for the poor and low income when UPMC closed Braddock Hospital, leaving the Mon Valley with poorer care and greater vulnerability. Number 2, bring hospitals and medical facilities under public control for the duration of the crisis. Cancel our medical debt so that we can recover from this economic crisis. Number 3, immediate expansion of Medicaid to cover every resident of Pennsylvania, especially since 1.5 million people in Pennsylvania will lose their health care coverage as estimated by Hospital Management Associates. Number 4, immediate production and distribution of personal protection equipment, such as masks and gloves for all healthcare workers and frontline workers, such as those in grocery stores and delivery services. Our frontline workers are our brothers and sisters, and their safety must not be compromised. And our final demand, number 5, immediate production of testing kits for universal testing with no out-of-pocket costs for testing or the treatment of COVID-19.
Woo! Thanks, Ann.
All right. So this is St. Joe's Hospital right here, Lancaster in Pennsylvania. As you see, a fully functioning hospital closed in this COVID-19 pandemic. People over profit. 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 Thank you. Over profit. People over profits. People over profits. Woo! All right.
All right, everyone. Hello. My name is Tammy Rojas. I'm a member of Put People First PA, and I'm on the coordinating committee of the Pennsylvania Poor People's Campaign, a national call for more revival. Not only is the Lancaster Healthcare Rights Committee of Put People First PA represented here today, but we also are allied and have representation from the Lancaster County Homeless Union through the National Union of the Homeless. Woo! Go TIF! All right. So as you heard, kind of Ann go over and share our demands and kind of uplifted some of the reality in regards to UPMC. So I'm going to go over and mention the stats that were reported today. So in Pennsylvania, we currently have 27,375 cases. 707 people have died from COVID-19 already. In Lancaster, we have 970 cases, according to the Department of Health. The Lancaster deaths, the state says we have 33. But according to the Lancaster County Coroner, Damatoni, we actually have 72. When looking up how many people are already hospitalized and how many people are already on ventilators when we have yet to see the peak of this pandemic, which we won't for at least roughly about a month or so from now, we have 2,503 people hospitalized and 664 on ventilators. In Lancaster, we have 168 ventilators and 44 are in use already. We have 47 ICU beds. That's it, 47. Altogether, in regards to looking at medical beds or surgical beds, people that would normally be inpatient hospitalized, the total number of beds we have as far as that goes is only 265 beds. That's it for Lancaster County. And as you heard Ann state, already in 17 nursing care and long-term care facilities that take care of our elderly. 17 have positive cases, and they're also the highest percentage that are dying from this pandemic. We need St. Joseph Hospital to be up and running. Woo! Thank you! Woo! Put people first! Alright. Now, what was interesting, we'll wait for the bike to go by. Woo! What was interesting is before we took action today, we had a conversation with, we won't name the source, but we'll say that, you know, they definitely have ears to kind of a little bit of what's going on. And to hear that the Army Corps of Engineers said that they could get St. Joe's up and running in under a week, and it's still not ready, kind of makes you wonder what's the holdup here, right? The longer we wait, the more unnecessary deaths that people will suffer here in our community. The thing about UPMC, the healthcare profiteer that now owns St. Joe's, right? They closed this hospital despite the fact that we were always in need of this hospital. It is widely known in our community that Penn Medicine Lancaster General Hospital has operated over capacity. We held a State of the City address where a member from a partner organization shared their story. That event took place in January. Their story took place in late November, early December. And they shared their experience about the overcrowded emergency room. Do you think all of a sudden Penn Medicine LGH can handle this? No. That's right. One thing that Penn Medicine is looking to do, right? Because let's be honest. First, let's talk about UPMC. UPMC is a multi-billion-dollar global corporation that also owns an insurance company operating under the guise as a non-profit charity, which means what they get from that is they don't have to pay property taxes. They can volunteer a pilot deal, right? Well, they're trying to say that they don't have the money to get St. Joe's up and ready. And in order for them to open up St. Joe's or open up the hospital they closed in Sunbury, they want our tax dollar money to do it. They said they can't do it without our tax dollar money. Well, how can a multi-billion-dollar corporation that operates as a nonprofit pay their CEO $8.5 million a year, give him a personal chef, a chauffeur, and a private jet, and many other top executives' million-dollar salaries? That's right. No excuses. No excuses. Nope. The thing about Penn Medicine. Penn Medicine is Lancaster County's largest employer. They own massive amounts of real estate throughout Lancaster County. So when we look at these healthcare profiteers, they might as well just be real estate agents and developers. Because that's what UPMC wants to do with this hospital. We are facing a global pandemic, and they want to sell St. Joe's and turn it into luxury housing.
People over profits.
That's right. People over profits. People over profits. People over profits. People over profits. Now, we like to hear touted that it was like some good news that UPMC and Penn Medicine were partnering for a testing site, right, at the Clipper Stadium. Well, of course healthcare profiteers work together, right? And we may want to tout that testing site, but in reality, they got to close them down all the time whenever there's bad weather. So why isn't St. Joe's being used as a testing site and for critical care? We used to have the ambulance bay right there. Easy access to the people of the community. And that's gone, right? One thing that must be brought to light is both UPMC and Penn Medicine, that now operates the Lancaster General Hospital, both stem to profit and benefit from the sale of St. Joseph Hospital. They both benefit. Two healthcare profiteers benefit from this not being an operating hospital. How ironic does that sound? UPMC stands to make millions to rezone this property and sell it. Whereas Penn Medicine, if this hospital isn't open, they get to continue to expand, hog up real estate, and dominate healthcare in our community. We're hearing stories all the time that the healthcare workers are not being protected. And they're basically being threatened to not speak out. That is wrong. Penn Medicine would rather help and put resources into putting a makeshift hospital at the Marriott Convention Center instead of doing what's needed to get this hospital up and running. The other thing about the Marriott. How about that Marriott, right? We all know the story. Technically, the city has leverage there, right? They made a deal with the Marriott, so technically they own the land, and they just lease it out. So the Marriott gets to expand, they get to pay their workers low wages. I know because I used to work there. And they don't have to pay property taxes. So why are we not getting our homeless off the street and into rooms at the Marriott? What do you say, Tiff?
Get my people off the streets in the Marriott.
That's right. Thank you.
Homeless,
Not helpless. Homeless, not helpless. Homeless, not helpless. Homeless, not helpless. You know, we were basically hearing, all these feel-good stories, like there's a day shelter now, and everything's all good. Everyone was advocating for the homeless a couple weeks ago, talking about this day shelter, and then now, crickets. Guess what? There's still several dozen people living in Ben's Park. Why? They have been living there for a long time. They don't need a day shelter. They need shelter. Period. Dot. Enough is enough. So, anybody else have any last thoughts they want to shout out? Governor Wolf, seize St. Joe's and reopen it. Seize Hahnemann and reopen it. Put all hospitals in Pennsylvania under public control now. They've done it in other states. They've done it in other countries during this pandemic. It's time to do it now. The longer you wait, the more unnecessary deaths that'll happen. Because the thing about these healthcare profiteers is they're not operating to save lives. They're trying to operate and salvage their profits over this pandemic. They're more worried about losing money than anything else. It's time to end the corporate greed, and it's time to fight for a more just healthcare system so that when we face the next pandemic, or while we're continuing to fight this one, our people will be okay.
Reopen the hospitals.
Reopen the hospitals.
Inaction equals death.
Inaction equals death. Inaction equals death.
Inaction equals death. Inaction equals death.